In the movie Still Magnolias, Dolly Parton's character Truvy says, "Honey, time marches on and eventually you realize it's marching across you." And as we get older, we notice those signs of aging more and more. So what's the best approach to treat aging skin? Well, Dr. Bill Johnson of Innovations Medical is back to tell us about a more combined treatment. Make us look younger, please, Dr. J.
Good morning.
Combined therapy, that's the name for today.
Well, and what has been the trend in medicine for the past 2 or 3 decades has been to use multiple treatments to treat a condition. So if you've got high blood pressure, you've probably been told to lose weight, exercise, and been put on 2 or 3 medications.
Okay.
If you've had cancer, you probably have had surgery or radiation or chemotherapy or all of them. And if you had chemo, you've had 2 or 3.
Okay.
And the reason is each of these techniques is approaching the problem from a different direction.
Okay.
And when we approach it from several directions, we get a better overall treatment.
Okay, that combines therapies. That makes total sense.
So when we do anti-aging therapy, the same thing. We want to approach it from several different directions.
All right, let's talk how it applies to anti-aging and the treatments you use for that.
Well, very often we start with different devices that approach anti-aging from different arrays. So this is Thermage. We've talked about Thermage a lot.
Yep.
But Thermage uses radio frequency energy to tighten the skin. And as you can see, it makes a real difference. And this is about after 6 months.
Yeah.
And a real difference in the appearance of the age. And it does it with no downtime and in just about an hour in the office. So Thermage is a really good place to start.
Really good place to start.
Okay.
Those results are really great. Okay.
The other area that we talk about a lot is resurfacing lasers.
Yes.
And they approach it differently. And these take off hundreds of little dots of skin and have a little bit of downtime. Now, some of them don't have much downtime. But again, a real difference. You can see around her eyes what a difference this makes.
Yeah, big time.
Okay.
That's all resurfacing lasers,
and
right?
All resurfacing laser and here. Just a big improvement over time with the resurfacing lasers. And you can do these two together. So they complement each other and they do different things, different approaches to the same problem.
Okay, and that's what the consultation process is all about. So there's other things you can do also to add to their skin.
One of the things we talk about is a group, we call them injectables.
Right.
Things we use a needle and put into the face.
I'm familiar with the injectables.
I'm familiar with the injectables. A lot of people are. And so Botox is kind of the first injectable we ever think of, because Botox does a fantastic job with wrinkles caused by our muscles. And there's nothing out there that does a better job than Botox. Now, Xyman is a new Botox, if you would, and it's the same botulism toxin and a little bit less expensive, so it makes it available to folks that couldn't afford Botox before.
Okay, all right, there's different options now. It's come such a long way.
Now, one of the other things that we use is an injectable like Radiesse, or you can use Restylane. Now, this is Radiesse in the back of the hands, and this is about 10 minutes later, okay? So her wrinkles here and the appearance of the veins and overall in her hands is improved.
Wow. This is 10 minutes later?
This is about 10 minutes later.
What?
So, and it really doesn't even require any anesthesia or anything. It's just bam, you do it, smooth it out, and you're done.
Because our hands, like mine, like they look really old when they're fair skinned.
So this is a great way to address that, to add the volume of the back of the hand, smooth out those tendons and wrinkles, and it, again, can make a real difference in just a really short period of time.
Okay.
Okay?
What else are we seeing for volume loss?
Well, the other thing, kind of the king of volume loss is to use your own fat.
Yep.
So this is a patient, this is her picture at 22. And this is her same lady at 50 before getting fat transfer. And then this is age 50 afterwards.
Making her look more natural to what she looked like before.
And the idea is to make her look as much like the 20-year-old as possible at age 50. So she doesn't look like someone else, but she also has a youthful look.
Very much. I want to quickly glaze upon the fact that you brought these products. This is another innovation that you have.
And again, one of the big things that we add, one of the other modalities we use are topical products that we put on our face. AQ Skin uses growth factors, human growth factors.
And we're going to be talking about this next week, is that right?
Yeah, and we're going to actually be talking about the top of my head because I haven't started using it yet.
And we're going to do it on. Okay.
So we're going to do it. We're going to start doing it.
Picture.
We'll keep this. We'll keep this in the archives.
All right.
And here in a few weeks, we'll see. We'll put the test, see if it works.
We'll kind of see if it works. Innovationsmedical.com is where you can go for more information. Our Dr. J off-air segments are also up there, and you can call the Dallas office 214-420-7970 in Fort Worth 817-744-7904. GMT's coming right back.